Here's an interesting question, I think, to the panel. What endpoints or inclusion, exclusion criteria might be appropriate for studying a neurotrophic dry eye product candidate? Mark, would you lead off?
Sure. Well, let's just talk about what neurotrophic is, and that there is a subgroup that has a decrease in corneal sensation. So in other words, they're going to have a less robust tear reflex for irritants. They're going to have a less robust blink defense against irritants. And for baseline, depending on the level of neurotrophic changes, it can affect the rate of mitosis and epithelial growth so that you may get non-healing defects. It's going to affect, as Darlene was showing, your input into the afferent autonomic nervous system so that you're going to have less mucin, less aqueous, and probably less oil. So looking at that as a pathology, how would you study that? Well, these are people who have like almost micro leprosy, if you want. They're not able to quite protect themselves. It should be very apparent in stressed environments that they don't respond as well, and that anything which improves their ability to respond it should be fairly relatively easy to detect. The same one would expect in the environment if you could control for that. So I think insofar as you can identify these people with either Cauchy-Bonnet, decrease in vision, the type of exposure keratopathy associated with it, or some of the puff ways of defining decrease innervation, I think all those may be good on the inclusion criteria stage. And then I turn to Dr. Chambers and I say something along these lines. Would this be a good start for a program development, and any suggestions on the regulatory side of the ClinMed pathway?
Yeah, and I would agree that I would have my entry criteria based on Croney-Boucher testing and pick a particular level of corneal sensitivity and say anybody that falls below this is acceptable for the clinical trial.
You know, I assume that would probably be a different type of indication or clinical trial than a dry, because obviously these patients won't have a symptomatic improvement since they don't have any sensation. But you know, paradoxically, that's one group, like I showed in my talk. You know, I think there's a subset of severe dry eye patients that do have a neurotrophic component, particularly Sjogren's syndrome, where you know, paradoxically they won't have any symptoms to begin with, and as their ocular surface improves, they actually, and they get nerve regeneration, they actually start to get worsening symptoms. So there's a disconnect in the opposite way. So those patients, you'd have to be very careful, I think, from my perspective, about evaluating their symptoms.
Yeah, but you would expect to see the corneal sensitivity increase.
Absolutely, yeah.
It just occurred to me, and I'm curious, Dr. Chambers, whenever you might test a compound for a neurotrophic indication, is there a possibility that or any other subset of dry eye would qualify as an orphan indication because of the relatively small numbers that would exist for that particular disease?
Essentially, any population with an incidence of less than 200,000 potentially qualifies as for an orphan designation. That decision is made by a group that's in the commissioner's office, and they evaluate the potential incidence and will designate products as orphan products for development.
So it's a possibility, but we just won't be able to address it further here. Is that what you're saying?
The criteria is literally if your incidence is less than 200,000. So you either meet that or you don't meet that. It's within the United States.
Okay. Good. Thank you.
I think one of the corollaries to that, and maybe you want to get into that, would be that you still have to be scientifically rigorous. You have to power your study so it's relevant. And
Well,
I think
the designation affects what some of the tax benefits are and what exclusivity is afterward. It does not affect the criteria for approval. So all the same things that I was talking about before, whether it's an orphan product or not, all still apply.
It might affect the total number of patients that you have to subject that are subjected to the drug, and as you've said, provide some additional regulatory exclusivity. Is that correct?
Yeah, it actually is unusual to affect the total number of patients.
Okay.
In the trial, with the exception of there are some metabolic diseases where there was a product that was approved based on approximately 20 patients,
That's
but
right.
there were 24 patients in the country with the disease. There is a limit to
Could you get into
how far
more?
you can study it.
Can you get into more details on how we can do a study with only one patient? What would the protocol look like?
Did you find that?
Multiple crossovers, perhaps?
Well, I started with the left-handed freckles. I think you have to add a few more criteria to it.